Super excited to have Jeff Rutledge on today. He is a physician in primary care, emergency care, and he is one of the pioneers of telehealth. Started a very successful company, HealthTap, co-founded that in 2010. He's been in the space for a long time. He's done AI research early on, was clearly ahead of the curve on telehealth before the pandemic. Excited to see some of his vision for the future and where things are going in the space.
Nice to see you guys today. My name is Dr. Jeff Rutledge. I'm a board-certified internist and emergency physician. Also have a PhD in medical computing from Stanford, which has driven me to use technology to try and improve the process of care. I've been in the clinical practice of medicine for almost 40 years now, and bring together the ability to understand how clinical processes work with the technology drivers to improve the efficiency and effectiveness of the care that doctors deliver.
Quick question. I like to start with the easy questions. Where do you see things going for HealthTap and the telehealth industry at large beyond kind of AI-based X in the coming years?
It's a great question. The reality is the opportunity to use technology to make healthcare better has been the driving force for me in my entire career, starting first in creating the first consumer website that became WebMD, subsequently working at Hippocrates, where we had an application giving doctors information at the point of care to guide the process of care. I started HealthTap 15 years ago with the vision of bringing technology to improve the process of connecting doctors and patients, realizing that we needed to be able to deliver healthcare on technology platforms and that we could do this more efficiently and more effectively than often happens in the office. And we were pretty early in the space. In fact, when we first started, the video codecs did not exist to allow for high resolution video on mobile devices, but we anticipated it was coming and prepared for it. We started our first video consultations, I think it was 2012, was when we got started, firmly believing that there was a role for virtual care and that it would at a minimum complement the care delivered by doctors in their offices in a more efficient and less expensive way. What I didn't fully appreciate, and it took some time to realize the scope of what's actually possible to do virtually. When you have a high resolution audio and video connection on a platform that is bringing patients and doctors together, it is quite surprising how most of the time, most of what the doctors need to do, certainly in primary care, can be delivered virtually. And even more important and somewhat counterintuitively, we discovered that doctors and patients can connect in very deep and meaningful ways when they've never met in person in the office. The doctor is not laid on hands, but the quality of the connection and the fact that when you have a video visit, the doctor is focusing entirely on the patient, looking at this is the only thing they have. They have a video channel looking at the patient, and patients respond very warmly to having the undivided attention of their doctors.
That's awesome. I think the vision is really to return back to that and make it higher and higher quality connections that the humans can have, sort of clinician to patient. Is that right?
That's a really good point. I mean, the technology enables the doctor to do things that otherwise would not be possible. The doctor can do a visit with someone while they're still in their home without physically traveling to the home to see the patient. And similarly, there are other opportunities. Once you have the care being delivered on a technology platform, now you can bring to bear other interesting and useful ways to apply technology to improve and support what the doctor's doing. So a good example of that, and I think you mentioned Dr. AI, we've implemented AI as a method of doing a pre-visit interview. We take advantage of the power of the large language model to understand what people are saying and to engage the patient in a conversation, which is very similar to what the doctor will do when they first see the patient. By having the person answer all of the routine questions and the things that the AI can think of relevant to the patient's problem at hand, we can assemble information that dramatically speeds up and makes more efficient the doctor's time with their patient. What that does, of course, is it gives the doctor more time to dive more deeply into what's going on with the patient and to assess other things like social determinants of health and other impediments to care that sometimes doctors wouldn't have time to get to. So in effect, the technology serves to improve the efficiency and effectiveness of the doctor while maintaining a focus on the individual personal relationship between the doctor and the patient such that trust is developed and patients can understand and respond to how their doctor is guiding them.
Any kind of best practices, things you've learned that you would say, hey, I learned these things the hard way. Here's some advice. What kind of advice would you share?
Well, I like to make the point that it's all the quality of care that's delivered and the outcome that happens is a function of the quality of the doctors and their ability to connect with patients. Telemedicine got started on a much more transactional basis where people perceived that it was a way for someone to get something that they wanted. I have my ear hurts. I think I need an antibiotic. I'm going to push this button and connect with the doctor that I don't know for a quick transaction to get the thing I want. And that, although there may be a role for digital urgent care and sort of immediate transactional care at the patient's request, the reality is that the long-term benefit of primary care is associated with ongoing care, thinking through and managing and understanding healthy living and lifestyles, preventive care, and managing chronic conditions as they develop over life. And what we've discovered with telehealth is that it's possible, in fact, easier in some settings, to generate that relationship to connect the patient with the doctor and actually deliver primary care. Taking a step back, recognizing that actually in America, too many people don't have a primary care doctor. And there are many reasons for that, cost and accessibility being high among them, and a relative lack of the ease of access to primary care doctors. And one of the wonderful things that telehealth does is it enables people to connect with a primary care doctor in a much more convenient and also less expensive fashion.
Beautiful. It sounds like there's a huge role for PCPs, and it sounds like you're really passionate about how healthcare goes from one complaint to an ongoing series of conversations. So I really love that. Wanted to ask about. Oh, go ahead.
To expand on that just a little bit, I wanted to describe how what's been demonstrated and measured repeatedly is that when someone has a trusted relationship with a doctor, the benefits are dramatic and objectively measurable. When people have a doctor they trust that they can turn to, who's available to them when they need them, the presence of a primary care doctor in a patient's life means they actually live longer measurably. And interestingly, in much higher rates of preventive healthcare services are delivered. And interestingly, their total healthcare costs go down. When people have a doctor they can turn to, they don't get care that is unnecessary, and they do get care that actually helps them. And so this is measurable. And the impact of having primary care in your life is actually a measurably wonderful benefit of living longer, feeling better, and spending less money on healthcare.
Any unique or noteworthy tech services or technology your team uses to get the job done? Speak patient care, whatever comes to mind.
Well, you hit on a really important point, which is accessibility. On HealthTap, you can go on and find a doctor, get an appointment. Typically, it's same day or next day, and almost always the same week to get a new appointment with a doctor that you have chosen. You get to see the complete range of doctors who are available and pick the doctor who matches the kind of doctor you'd like to see for yourself. Once you're established with the doctor is available to you. And again, same day, next day appointments are the norm on the HealthTap platform, so that once you're established with a doctor, that doctor is available to you. Even more important, once you're established with a doctor, you can send text to your doctor. It goes directly to the doctor, and the doctors will respond to you individually, usually right away, but by our service level commitment from the doctors is to answer by the next day. So you have a doctor available to you who knows you, who can answer questions related to your health. And so the infrastructure and the framework of the technology enables doctors to connect with patients more conveniently. We're also very proud of the way we've implemented AI in a support role to reduce the workload and give the doctor more time to interact with their patients by conducting a thorough interview prior to the visit, and also writing the draft of the note for the doctor, so the doctor has more time to spend talking with their patient on top of the basic information that's already been collected before the visit starts.
You've mentioned a lot of cool technologies. You're the tech guy, so obviously there's a lot of technology, from the immediate response, the infrastructure, the AI support tools, and anything as of late that the team or the company spent money on that everyone had high hopes would get the job done but didn't?
That's a good question. The real impediment or the limiting factor for HealthTap has simply been a matter of getting the word out, getting people to understand the opportunity to find and keep a doctor virtually has not been well understood. People have not recognized or known that it was even possible to get a doctor for yourself, someone that would know you and be available to you on an ongoing basis. So the real impediment has been efforts to how we've marketed the program, how we've enabled it, and how we've distributed it to people who need it.
I'm curious to hear a little bit on the clinician side too. So you've been involved in, clinician facing and just generally educational initiatives throughout your career, academia, WebMD, Healthion, and Hippocrates, all of that. I'd love if you could talk a little bit about the role of kind of continuous improvement, the lens of CME for clinicians in telehealth, maybe a little bit about why and what you do with HealthTap Global Rounds, those sorts of things, what's going well and what kind of challenges you think telehealth providers are facing.
We started the company actually as a question and answer service. I mentioned we didn't have video codecs when we first started the company. We started a text-based question and answer service. And I reached out to doctors and gave them the opportunity to help people by answering their questions. We actually didn't charge people to ask a question that we would show to the doctors. We also didn't pay the doctors to give answers. We were actually told we were out of our minds to ask doctors to give answers to patient questions without being able to pay for them. But it turns out that doctors are actually interested in understanding and helping people and learning in the process. So we developed a question and answer service, which is still live on HealthTap. You can go there today and ask a question. You'll see it's already been asked and the answers are already there. And the answers that are there have been peer reviewed by other doctors. We create an environment that allows doctors to share their knowledge with each other and with patients. That service has collected nearly 100,000 U.S. licensed doctors who've signed up to participate, and we've so far collected about 3 million answers written by doctors to questions. What that means is there's now a library that exists for people to get answers from their questions from their doctors. You mentioned continuing education. One of the features that we've seen, one of the behaviors of the doctors, is they're using our platform to try and improve their knowledge. But they're improving it in ways that are relevant to the things that people care about. So if someone asks a question and a doctor doesn't know the answer, the doctor says, well, this is an opportunity to learn the answer. One of the things we did on the platform, we built the technology to make it possible for the doctor to say, I want to learn about the topics of this question. So you can say, I want to learn about this by clicking the box. And we run a search of Medline and do a PubMed search and show the doctor in real time journal articles related to the topics of the question. The doctor can refine the query and do investigation and search and read about the answers to generate the knowledge to be able to give a better answer for their patients. And on HealthTap, the doctor generates continuing education credits by simply filling out asking for it by clicking the button to say, yes, I'd like to claim CE credit for this, and here's how much time I spent doing it. So doctors have access to unlimited Category 1 CME on HealthTap through the process of answering questions. As I say, we've had some very prolific doctors who have taken it as a challenge anytime they don't know the answer to a question to go learn about it and improve their medical knowledge.
I love that. And I think that's the kind of curiosity that drives the best type of learning versus trying to fulfill requirements and check the box, which we end up seeing a lot. I'm curious on the flip side, like, especially today, what kinds of things are keeping you up at night? What things do you worry about, and do you feel like are current challenges that you're working to tackle in the business in the next phase?
Well, you raise a really good point. It turns out we have received huge traction in the marketplace quite over the last couple of years. And certainly over the last year, we've had a number of really large distribution deals. We've now become the preferred telehealth provider for health sharing ministries, where they are enabling primary care to their members. And so we're seeing a huge upswing in volume. We have large national retailer distributions. I don't think we've actually announced it yet. We're going to be going live next month. And so what are my worries? My worries are being able to find more doctors and getting them on the platform, able to respond to the rising demand that we're having. That doctors, it turns out that in addition to the convenience and effectiveness of having virtual care for patients, for doctors, it's an incredible opportunity to have a more flexible way to work. Doctors can work from anywhere without the requirement to commute to work, without strict business hours, because the platform becomes available to the doctor to work on their schedule when they want to. And they can work the hours that they want to, and they can take individual time off. There's no constraint of staff and office and leased buildings that can't be allowed to be vacant or idle. We have a virtual platform that's available for the doctors anytime they want to work. So one of the issues is getting all of the good primary care doctors who want to be real primary care doctors to know that there's an opportunity to have a comparable living working as a virtual doctor with greater connection with their patients on the platform, on the HealthTap platform. Quickly, just wanted to mention that any doctor can sign up for a free account. You don't have to have a job. You can do this in addition to anything else that you're doing. You can participate in the large network of doctors who are learning from each other, doing peer review. They read each other's answers and weigh in. They can comment on other answers. They can answer patients' questions directly. They can also, if they're interested, there's a separate second step after you've joined the network, which is to apply to join the medical group in order to give care on the platform. So both levels of participation. And all doctors are welcome into the network. We're looking for primary care doctors, ideally those with multiple state licenses, to work with us in the medical group.
Awesome. Yeah, we'll include some details on that. Any last closing things? And David, if you have any questions, feel free to get it in. I know we have 1 minute left. So,
last question: what do you desire most in this world?
Professionally or personally?
Whatever comes up. Whatever comes up.
The reality is my mission has been to deliver primary care, and what I desire the most is for every man, woman, and child in America to have a doctor that knows them, that they can turn to when they need advice and help for their medical issues.
Love it. That's a man with a vision. I love it. Thanks, Jeff.
But it's what we're doing. It's why I've been at this company and persisted through thick and thin, as you described, to create a service that's actually available for everyone. And it's live and it's real now. And I invite you to try it if you haven't already.
Yeah, that's beautiful. Thanks, Jeff. Really appreciate the time. This was fun, and I'd love to follow up, show or otherwise. Really, really interesting, fun conversation. Appreciate you.